longer, harder. What we do is bigger is increasing girth, longer is increasing length, harder is erectile dysfunction. We're the guys that you come to when the pills don't work anymore. We're the guys that you come to when you want to change your size. And what we do is no surgery, no cutting, is painless. Go home same day, back at work the next day, and is permanent for life. So when I do these talks, what I'm really doing is I'm destigmatizing male enhancement. Because there's so much junk out there. There is so much junk out there. And guys are trying stuff and they end up with all kinds of results. But if you're going to have something done, you might as well come to somebody who's a male genitalia specialist. I'm a urologist. I've been a urologist for over 20 years. So the thing is that I always say, hey, if you did something stupid, like shot yourself in the penis because you're trying to stuff a gun down here or whatever, and you go to the emergency room, I'm the kind of surgeon they calling. So if you're going to have enhancement done, you might as well start with me. I'm that guy. Might as well get it right the first time because there are a lot of guys out there who are trying to do what we are trained to do. You can try to do it or you can be trained to do it. We're trained to do this. And when it comes down to male enhancement, I'm trained to do it. So come and see me. You can come from all over, all over. Our offices are in Warner Robins and also in Jacksonville. So, so if you're just joining, we're trying to destigmatize male enhancement. And I will ask you to like, share, and follow us. All right. So we can reach more people. We're trying to get the word out there because the thing is that, hey, we can take you to another level. But let's get into this talk because today this is going to be really interactive. This is from our confidence edition. And basically, the talk is would you rather? Would you rather? Would you rather be A or would you rather be B? All right. So, in this talk, I need you to actually put in the comments A or B because what we're trying to do is figure out what would you rather. And then what we're going to do is lock in from there. So, all right, today you don't get to stay neutral. You actually have to choose, right? There's no politically correct answer in all this. And you can't say it depends. You got to either pick A or B. All right? It's simple. A or B. Don't try to go off, but you can throw other questions in there if you got. But when we're voting, I need you to put A or B. So all you got to do is drop A or B in the comments. All right. So let's set some rules. This is a judgment-free zone. So there's no judging in what we're doing. Understand this. If you're quiet in the comments, I realize you're actually lying to yourself because you got in your mind if you're A or B. It's pretty simple. Don't make this difficult. I'm going to explain what your answers are actually saying about you. When we're done, I'm really going to explain what your answers are actually saying about you because understand this. This is the confidence edition. All right. So let's throw out our first question. We're going to go into round one. Ding, ding. Round one. Here we go. Money versus confidence. Would you rather, all right, guys, would you rather be wealthy but insecure? That's A. Would you rather be a wealthy guy but you're insecure guy? And what I mean by that is you got cash, you got money, you rolling, but you're insecure because you small. And you realize that, hey, I'm small down low. I got money. And the thing is that I deal with a certain level and all this other kind of stuff. I'm a high value man and all this other kind of stuff. But at the end of the day, you realize that you're not quite adequate down below. Or B, you're got average income. You ain't really rolling like that. Nah, you drive a certain ride for a reason. All right. But when it comes to confidence, you're swinging. Got all the confidence in the world because you just say, I'm blessed. Okay. So would you rather be A, be wealthy but insecure? Or would you rather be B? Be average income, but lots of confidence. Got a couple of B's out there? I'm trying to let you guys make your vote because I already know the real answer here. I can tell you what the real answer is when you start talking about male size and what you start talking about is money, is that money doesn't fix insecurity. Actually, it amplifies it. You can have plenty of cash flow and be, rolling in your pockets, but you ain't got no confidence. And I actually run into guys like that. They got all this money, but they don't feel comfortable even approaching a female if that's what they desire, a female, or approaching someone because their confidence is so low because of their performance and their size. Somebody says, give us a better deal. When they say, give us a better deal. So the thing is that basically, I can tell you that having confidence changes the game, completely changes the game. All right. Now, confidence shows up everywhere and including the bedroom. But now let's jump off into this round 2. All right. Because these are things that we can do something about here at UroHard for Men. Here it is. Round 2. Body versus size. Now, I got a lot of guys that come in, they love to work out, whatever, and these guys got a perfect physique. I mean, they yoked up. But when they drop their pants, they're average or below average. And, guys talk about, maybe it's, too much testosterone that we're taking or all this other kind of stuff causes them to shrink down or whatever. But, I got plenty of guys. When you go down to the gym, you see these guys throwing up all this weight and all this bravado and all this other kind of stuff. Yeah, they got this perfect physique, but dude ain't swinging. And that happens a lot of times. Or would you be a guy who just has an average body size? But when it comes down here, he's elite. This guy is swinging. So, A, do you want the perfect physique, but average size? Or B, you want an average body, but elite size? You got to choose A or B. Which one would you rather? Which one would you rather be? Because I see this all the time. What are they saying in the comments? Come on, join in. Tell me what you'd rather be because I run into this all the time. I got a B plus. We got an A and we got a B plus. A few B's out there because I see that all the time. I see guys who really put a lot into their body, but I'm like, to actually spend that much time in the gym is an investment. If you're going to invest that kind of time in the gym to get the rest of your body right, why not invest that kind of time into getting this right too? So, it's kind of like, does the carpet match the curtains? You've heard that before. So, this is a reality that we see all the time where the psychology actually collides with the reality of it all. You're strutting around, you got this great physique, but when you drop your pants, you're below average. Why not do something about it? All right, now here we go. Round 3. Here's it is. Skill versus size. Women always talk about that. You hear them say it ain't the size of the ship, it's the motion in the ocean. You've heard those kind of things. So when we start talking about it, the question becomes, would you rather? Would you rather have elite size? I'm sorry. Would you rather have elite skills? This is A, elite skills, but average size. Or B, would you have elite size but average skills? And you hear women talk about that all the time, that, hey, the guy was huge, but he ain't know what he was doing with it. You know, maybe it's the motion in the ocean. So tell me what you're thinking in the comments. Would you rather be A, where you got all these skills? I mean, you can work it, but you're small. Or would you rather be B, where you got plenty of size, but you ain't got great skills? You don't know what to do with all that size. So what do you think? Put it out there in the chat. I just want to know what guys are thinking out there, because this is something that we can do something about in UroHard for Men. We run into this all the time, where guys are not, their confidence is not where it should be. Remember, this is the confidence edition, because it's not that we just sell male enhancement, we sell confidence. And what we're doing is we're changing the game, because these are things that actually guys deal with all the time. So the truth is, the guy who really wins has both. He's got size and he's got skills. That's the true winner in this situation. All right. Now, I need you to be interactive. So put your comments in the chat, A or B. Here we go. Round 4. Do nothing versus take action. Would you rather stay exactly the same for the next 5 years? Same size. I'm going to stay at where I'm at. I ain't going to do nothing about it. Or B, do something that makes you uncomfortable. Like, hey, I'm going to take a chance and do this male enhancement, but it changes everything. Your size, your confidence goes off the chain. So, would you rather just stay the same size? Or would you like to be B, where you actually do something that makes you uncomfortable, but it changes everything? You're going to change the game. So put in your comments if you want to be A versus do you want to be B? Because we're changing the game. So be honest. Which one are you actually living right now? Are you one of those guys who kind of think about it like, man, I kind of want to be bigger. I wouldn't mind being bigger. Actually, the numbers show that 80% of men out there actually have thought one time or another that they would not mind being bigger. But it's the ones that actually take the action that change the game. Realize this, you only get to live once. Women have embraced this a long time ago. That's why they do breast enhancement, liposuction, BBLs. Women don't mind changing the game. They don't mind enhancing themselves. It's guys that are struggling with all this.
We have a few questions come in. One's been repeated several times.
Okay. We got some questions. Let me answer these questions.
Have you had any patients that have had any complications, like long-term or short-term side effects?
Now, actually, the thing is that honestly, what we do when we do our procedure, the question is, have we ever had anybody that had a complication? And I can tell you about a complication that I had, but they're self-inflicted. So we tell guys that, okay, you got to give us 40 days. 40 days, 40 nights, no sex, no anal, no oral, no nothing. Don't do anything, because that during that 40-day period, you're actually our responsibility. So we stay in contact with you. We want pictures every 3 days because we're so focused on outcomes. And if you have any questions, pick up the phone and call us. That's why we give you our cell phone numbers. So this is not a wham bam, thank you, ma'am. So here it is, a complication. All right. I actually had a guy who we told him, okay, after the procedure, what you're going to put on your penis is like a triple antibiotic ointment, because you're making sure that your skin is healing like it should, and all this other kind of stuff. So this dude actually ran out of the ointment. So he decided he was going to use something that he actually had there at home. And he said they looked alike. So he just put it on his penis and then it burned. I'm like, dude, what did you put on your penis? He actually put Preparation H, hemorrhoid cream, on his penis because it looked like the triple antibiotic. They look the same, but they're completely different. And it burned the skin off of his penis. Self-inflicted, when all he had to do is pick up the phone and say, hey, doc, I ran out of that cream. Is it important that I keep using it? Where can I get some more cream or anything like that? You know, Other things that we see is we tell guys to protect the skin. We don't want you to do any masturbating or whatever. I've actually had guys masturbate and cause the skin to come off. I'm just like, leave your penis alone. Just let it heal. So we are very strict to the point I tell guys, I say, look, if you're not going to follow directions, just go somewhere else. Just go somewhere else. Don't have our procedure done because for the next 40 days, all we want you to do is follow the directions. We give you a calendar that tells you what to do every day. I try to make it as simple as possible because you are an investment for us. My rule of thumb, if you do somebody right, they'll go tell one or two people. If you do them wrong, they tell 10 or 12. So the thing is that when you go to our website, UroHard.com, that's UroHard.com, you see all these testimonials where all these guys have gotten great results and they love the results. There's not a month that goes by we don't have guys coming back for second and third procedures. You say, well, why do they need to keep coming back? Well, the thing is that what we do is we tell them that we expect you to pick up 3.25 to inch in girth. All right, because it's the girth procedure that we do mostly. But the thing is that our guys are picking up 1.5 to 2 inches of girth. That's completely changes the game when you pick up that much size. Do you realize how much bigger your penis is when you pick up 2 inches of girth? You're a different guy. You realize what that does for your confidence? It changes the game.
Next couple questions are: how long does it take to see the results, and how long do they last?
Question: how long does it take to see the results, and how long do our results last? All right. First of all, you see your results immediately because our procedure is no surgery, no cutting. It's painless. Go home same day, back at work the next day, and it's permanent for life. All right. So immediately after results, we do what we call the great reveal. All right. We pull down the sheet and we let the guys look, and we love that look on their face like, wow, is that me? Yeah, bro. That's all you. Now, what we use is a filler that's a biostimulant. So our filler goes away, but it stimulates your body to make its own natural collagen. So what's left is your natural tissue. That's you for life. I don't care if you gain weight, lose weight, get shorter or taller. That's your penis size for the rest of your life. So when I tell people no surgery, no cutting, it's painless, go home same day, back at work the next day, it sounds as if it's too good to be true. I can tell you it's true because I've had the procedure done twice myself. Twice. So you can get bigger and bigger and bigger until you get as big as you want to be. Or at least to the point where your spouse says no moss.
Another question is: can I get longer as well?
The other question was, can you get longer as well? Well, the thing about it is, your heart for men, we can make you bigger, longer, harder. Now, our longer procedure is different because that's actually a surgical procedure, but it's minor surgery where you go home same day. But it's a ligament release that actually lets the penis hang out further. All right. So the thing is that we can increase the length of what you see hanging out. So there are different ways to do that. What I tell guys is that actually, when you do the girth procedure, because you pick up so much size that you got a bigger, heavier penis, it's going to actually hang longer. So a lot of guys get the girth procedure and they're like, wow, I'm happy where I'm at because it hangs longer now than ever before. Yeah, because it's just heavier and it's bigger, so it hangs longer. Or you can actually get it done where we do a ligament release. Or if you say, hey, I want it just stretched out, hanging long all the time, maybe you want a sleeve. That would be down the line of a leap procedure. So we got different things that we offer, when you start talking about how you size and how you want to look. It just kind of depends on what you're into. And I run into a lot of guys that are into different things.
Let me ask a good question. When did you first get the procedure done?
When did I first get the procedure done? Is that the question?
Yeah, I guess I want to know, are you, still happy? How long did
Oh,
it
when
take?
did I have my procedure done? I think I had my procedure done going on 3 years ago, you know, somewhere in there. But the thing is, I love my size. I love my size. I actually would go back again, but she won't let me. So it's all good. Where I'm at is where I'm at. But the thing about it is that what I always tell guys is you want to push her to the edge, but you don't want to push her over the edge. You know what I mean?
What
Take her to the
age
edge.
limit for older men and younger guys? Somebody already asked how young can you be? How old can you be?
I can tell you that, most of the guys, the question become, is there an age limit? What we're seeing is I get guys usually in their 20s and up to their 70s. So because we have an 18-year cutoff, you got to be greater, you got to be older than 18 and consenting adult to actually have the procedure done. So the thing is that, I just this week did a guy who was in his 70s. I mean, this guy was outgoing. I mean, he had the rings in his penis and all this other kind of stuff. That was his lifestyle. But, I just thought it was awesome. I was like, man, I hope that when I reach my 70s, that I'm swinging like you swinging because he's keeping it live. You only live once. Why not? So, yes, do I do guys in their 70s? Yes. I haven't done anybody in their 80s, but I've done guys in their 70s. So between the 20s and the 70s is usually where I'm seeing a lot of guys who are actually coming in to have male enhancement. Now, guys that are older, like in their 60s, 70s, 80s, I see a lot of guys in that age group more for erectile dysfunction because the pills aren't working anymore, or they're noticing they can't maintain erections, or things are falling off, or they're coming too fast. All that falls into this whole category of erectile dysfunction. So when people talk about erectile dysfunction, it isn't that I just can't get erection. It means I got dysfunction. My erections have changed over time, and I want to get something done about it. And I always say this: the penis is like a barometer. It tells you what's happening with the rest of your body. If you're a diabetic and you're starting to notice that it's harder and harder for me to get erections, then your body is telling you, or your penis is telling you, that, hey, your blood flow throughout the rest of your body is changing. So you start noticing that, hey, things are changing. Yes, because it's telling you, the barometer is telling you that your body is changing. Do something about it.
I have a question. The question is, after 40 days, does the filler go away?
The next question is, after 40 days, does the filler go away? The filler continues to gradually go away over time. All right. So there may be still some filler there after 40 days, but once you get a couple of years out, there's no more filler. So I would say your filler is probably pretty much gone after 6 months or so. All right. But the thing is during that period of time, that's where you're generating all this extra size from the natural biostimulant causing you to increase your collagen.
Are there any health concerns you need to know about? And how does the financing work? Do you have to pay money down and then monthly payments?
I just had an excellent question. Are there any health concerns? One of the biggest health concerns that we run into is watching out for guys that would actually have post procedural uh, problems. So I'm always looking for somebody. It's kind of like, because I've been a surgeon for so long, when you're getting ready to do a procedure on somebody, it's almost like you're looking for the snakes in the grass. What could possibly go wrong with this guy? doing his recovery from the procedure. So, fortunately, I got a lot of doctors in my family. And my uncle, who's an orthopedic surgeon, he told me, he said, look, a monkey can do surgery, but what separates everybody out is how well do your patients do after surgery. That defines your skills. So, what do I look for? If you're a diabetic and your A1C is above 8, I'm going to postpone your procedure. Why? Because you're gonna be that guy who's not going to heal well. Because your blood flow is attenuated with that much sugar. Your glycosylated hemoglobin is telling me that your A1C is 8 and your blood flow is not there. And blood flow means healing. So you're going to be somebody who's not going to heal. So, no, we won't do a circumcision. No, we won't do your male enhancement. And yes, you do have to get your A1C down before we ever do your procedure. I'm going to put you on hold because you won't heal up. And now it's my problem. Now I got to take care of you because you're not healing like you should. Well, the thing is that I'm kicking myself over here because I'm like Dr. Fussell. You knew that this person was not going to heal. So you should have canceled their procedure. Tell them absolutely not. So, yes, that's what I have to do. And that comes from me being a surgeon for over 20 years. Same thing. If you need a circumcision, I will not circumcise you if your diabetes is out of control. Or if we get you ready to do your procedure and your blood pressure is off the chain. You're in the stroke zone. I'm like, we ain't doing nothing for you today because you're not going to stroke out on me during this procedure. I'm going to send you over to your primary care doctor and I'm going to say, get his blood pressure under control, and then he can come back and have this procedure. So, yes, there are times when we say no, but that's just from all the years of doing surgery when I realized that, hey, you're going to be somebody who's going to have a complication.
Did you explain the financing?
Oh, didn't explain.
I got 2 more questions.
Okay. All right. Financing. All right. So, thing is, with our financing, basically, we can meet you where you're at. We got financing programs for good credit, bad credit, no credit. All right. Now, our procedure, when we start talking about costs, if you're just getting the shaft done, if you just want to get the shaft done, then the cost is $79.50. That's just the shaft. But on top of the shaft is the head of the penis. All right. That's $3,500. But if you do both of them at the same time, then that's $99.50. Now, the thing is you say, Doc, I ain't got $99.50. All you got to do that is put down $1,000 at the minimum. But understand, you're going to have higher payments and you're going to end up paying more interest because you only put down $1,000. So you put down your down payment. We work out your financing. We usually give you up to 2 years to pay for it and things of that sort. So we can get you done. We do have financing. So yes, we can help you. Make it happen. Captain, make it happen. All you got to do is make a decision.
Does this help with erectile dysfunction, and can you use Trimix injections with it?
Now, the question is, does the GERP procedure, where we make the penis bigger, help out with erectile dysfunction? I'm going to tell you right now, it does not. You can have a big penis that won't get hard. But this is what we do. Because when we do our procedure, there's no surgery, no cutting. It's painless. Go home same day, back at work next day. When we do our procedure, we're actually just making you bigger. But for those guys that have erectile dysfunction, I say, look, after we make you bigger, then I need to help you work on your erections. And that's what I've been doing. I'm a specialist in erectile dysfunction. I'm the guy you come to when all the pills don't work. And if you're a guy that does injection therapy, yeah, we got you on that too. And yes, you still can use your injection therapy, trimix, bimix, quad mix. It all still works. You're just swinging a bigger pipe now. That's what happens. As simple as that. What was the next question? Since guys are actually interacting, giving me these questions.
What's the best ways to fix blood flow without taking medication?
What's the what now?
What's the best ways to improve blood flow without taking medication?
Okay, all right. Somebody asked, what's the best way to improve blood flow without taking medications. I can tell you that there are things out there that you can do, but we're starting to get into supplements and all this other kind of stuff. Uh, when it comes to supplements, I believe in, beets and beetroots and stuff like that, nitric oxide boosters, things of that sort. But here's the problem. Here's the problem. All are not made the same. So you might go get a beetroot from one company and it works great. And you go get a beetroot from another company, it doesn't work at all. All right. Same thing with a nitric oxide booster, whatever. Trust me, blood flow is the key to life. You got to have good blood flow. So when you start doing things that increase your nitric oxide, get those vessels to relax, get blood flow throughout your body, that's when you know you're living. All right. It gets your blood pressure down, all of that kind of, but it relaxes the vessels. So understanding blood flow is key. So you got to make sure that you maintain blood flow, and that's what's going to help your tissue and your body throughout your life. And the first thing that's going to tell you that there's a problem with blood flow is your penis. It's going to tell you because it's the barometer. So, yeah, if you could go out there and juice your own beets, or, buy other beet supplements or something like that, or you can look into, things that increase your nitric oxide, because beets do that also to relax those vessels. And that's part of the mechanism of what happens with the PDE5 inhibitors. When you start talking about Viagra, Cialis, what all they do is increase nitric oxide.
Okay. The Kegels exercises really work for men. What can you do for PE? Premature ejaculation, I think.
Okay.
And,
So our question was, do Kegel exercises actually work for men? Yes, they do. All right. So the thing is that there's a muscle down there and the pelvic floor and all this other kind of stuff. That's where you get into the bulbar cavernosus muscle and all this other. Basically, what happens, it helps hold the blood into the penis and help you maintain your erections. So yes, Kegels are good. Kegels are good for men. Yes, do Kegels. There's nothing wrong with that. And it will help you maintain good erections. It won't be the fact to help you get the erection, but it helps you maintain the erection because that muscle down there, you can tighten it up. So yes, Kegels are important. What was the next question out there?
what can you do about PE?
PE. I'm assuming that's premature ejaculation, not pulmonary embolisms. All right, because we ain't talking about that. All right, so the whole thing about PE, let me break this down. This becomes something that I have these conversations about all the time. Now, there's a thing called the central nervous system. All right, what's going on in your head can affect your central nervous system because there are other parts of the central nervous system, like the autonomic nervous system. And the autonomic nervous system breaks down into two parts. There's the parasympathetic and the sympathetic side. The parasympathetic side is when you're nice and relaxed. That's where you get ejaculations. I'm sorry. That's where you get erections. All right. When you're nice and relaxed, glass of wine, I'm chilling out. You can get erection when you're in the parasympathetic state. All right. The sympathetic side is your fight and flight side. That's over here where you get too excited, things of that sort. So basically over here is what controls ejaculation. It's kind of like swinging a pendulum back and forth. So you're with the significant other, you're nice and relaxed, you got erection, you're in a parasympathetic state. But now you guys are getting it on. Things are going great. Hey, you're really enjoying it. And now the sympathetic side of your nervous system takes over, and boom, you pop off too quick. Premature ejaculation, PE. It happened. What can I do to stay over here to keep myself nice and relaxed? Well, because we understand when guys get erections versus when guys have ejaculations, we understand that the sympathetic side also happens with anxiety, things of that sort. Do you have a lot of anxiety? Do you worry about, hey, man, I'm worried that I'm not going to satisfy her? You're that guy that's in the gym, you got this great body, you look great, but you're below average down below. Yeah, you got a small penis. And she's over here drooling, thinking, hey, everything matches, you know, the curtains match the carpet. But what you find out when he dropped, man, really? Yeah, that's what happens. And you got anxiety because that's you. And what does that do? That swings the pendulum over here. So now all your anxiety interacts with your sympathetic system. You can't even get an erection. So the thing is that, or when you do get ready to do something, boom, you're coming too fast. So what do? We put you on anti-anxiety medications that help you stay calm. If I can keep you in a calm state, we can keep you from coming too fast. And that's how you control PE or premature ejaculation.
All right. Someone on Instagram said they had a consultation scheduled a couple months ago and never got a call.
Oh, someone said that they had a consultation schedule. All you got to do is call us on our phone, 478-225-9324. We will handle that today. All right? Just pick up the phone and call us. 478-225-9324. And I'm sorry that happened.
Someone says, if you want to get both the release and the sleeve, which would you do first?
Well, actually, we can do both of them at the same time. But usually when we do, the question becomes if you want to get the release and the sleeve. Now, just to understand, make sure everybody's on the same page, is that a sleeve is for somebody who wants their penis to hang longer. They say, hey, being a grower versus a shower, I want it to hang longer than what is hanging. I want to keep it on stretch, things of that sort. So we can actually put a sleeve under the skin. Usually we don't do the sleeve unless you've had the male enhancement procedure at least twice. So we get you enhanced at least twice. So we got great size, but you want it to hang longer. So now we can actually put in a sleeve, slide that under, and do a ligament release at the same time. And now you're going to hang longer. It's going to stretch longer and it's going to hang longer. So we do them at the same time. Hope that answered your question. Wow, you guys are interactive. The questions are just coming. I appreciate that because we had this whole thing going on about the confidence series that we're doing here. Let me see. Did I finish my talk on this confidence series?
What direction do you suggest for an individual that does not have the financial resources?
The question becomes, what do I suggest for the guy who does not have the financial resources? Well, guy, you got to save some money and you got to look at what you're doing, with your cash flow and things of that sort, because, you set goals. You set goals of, what do I got to do to get there? All right. And just to make your goals realistic, you can actually call us and get a consultation and talk to us so you can actually understand what it's going to take, because sometimes what you realize is that it's not as far out of reach that you thought. All you need to know was, what were the real numbers? What are the real numbers so I can actually get this male enhancement done? So this is a very good question. Don't think that you can't get it done. You can get it done. You just need to understand what do you got to get to. You need to understand, if I put down X number of dollars, what's going to be my monthly payment? Does that really work out for me? Can I actually do that? That type of thing if you need financing. So yeah, we can work it out. But don't go rob a bank or nothing crazy like that.
Okay. Somebody said they want to get some UroHard swag. Do we sell t-shirts and hats?
Somebody asked about UroHard swag. Yes. You see my hat? Where's my hat over here? You see my hat over here?
Right behind
Yeah, it's right behind me. So yes, those hats are going for $40. So yes, you're welcome to get some UroHard swag. But for the guys that actually have our procedure or have something done, we offer them a hat for free. So you can get your hat, just buy it straight out, or you can just come down here and get bigger, and we're gonna give you a hat because we want you to represent. But understand this: when you wearing the hat, they know you swinging. That's right. Don't put my hat on if you small. Small guys don't get to wear my hat. My hat It's only for the guys that are swinging. Trust me, if you wear the hat with confidence. If you see this hat anywhere out there, you know he packing. All right, let me try to get my confidence down. I want to show out. All right, so are there any other questions here? Because I know we just talked right through our time because you guys are asking great questions, and I appreciate you being honest.
What's the most unexpected thing you've had happen to a client during a procedure?
Say what?
What's the most unexpected thing you've had happen to a patient during a procedure?
I can't think of anything that happened that was unexpected. I mean, we're in a controlled environment. You're actually in my private operating room. I control the environment. We set up an environment that's really chilled out. We're playing jazz music. The guy's chilling out. He's got his cell phone. Most guys actually take a nap. All we want you to do is just lay there and be still. Some guys say, "Doc, can I ask you questions while you're working?" Sure, we can have a conversation. So the thing is that you know, we really don't have no surprises. Why? Because I'm a surgeon for 20 years. I know how to control my environment. Yeah, and I'm a little bit of a control freak when it comes to that.
Okay. Someone says, I would like the total package, but I would like to be put to sleep if possible.
I can tell you it's not necessary. It's not necessary to go to sleep or anything like that, especially, when guys fall asleep. So we got, if you're asking to be put asleep, what you're really during the procedure, what you're really dealing with is fear. So come here, let us get you past the fear factor. And I promise you, once it's all said and done, you're not going to hurt. There's no way that a guy can see me on social media, drive several hours in his car, come in here nervous as all out, like a cat in a bunch of room with rockers. And he's nervous. And once I sit down and I talk to him, I spend enough time with that guy to the point where I've answered all his questions. He gets down there on the table. He's so relaxed, he actually takes a nap. I consider that a compliment.
What days do you perform procedures?
Usually we perform procedures Monday through Fridays. There are occasions where we actually do procedures on the weekend, because some guys can't get off during the week or whatever. So we make exceptions, but it has to be scheduled. We got to look. I mean, I think somebody was asking me to come in on Easter Sunday. I'm like, look, dude, I'm not coming in on Easter Sunday. I got to spend some family time, so, got to let the kids go chase the eggs. All right.
Do you do every procedure and how long does it take? I think that means do you personally do the procedure? I'm not clear what they mean.
They asked, do I do the procedures and how long do they take? Our procedures,
Every procedure.
do I do every procedure? Well, the thing is that I got a team of two. It's me and my nurse practitioner. Now, she's also board certified in urology. All right. She was also the second nurse practitioner in the state of Georgia to become board certified in urology. So she knows her stuff. She's extremely good. She does multiple procedures. So what we do is we assist each other. So yes, she's helping me. She's in on the procedures. And if you haven't met Lisa, you're gonna meet Lisa when you come down here because we've been a team for over 20 years. And we're good like that. And we're confident about what we do. Doctors actually call and say, "Hey, I'll just see Lisa." Why? Because they trust her. If doctors can trust her, then you can trust her.
What are the different procedures that you do? I know it probably just depends on the client's needs. And could you break down the procedures?
Whew. That's a mouthful. Somebody asked me, what was the different procedures that I do? Of course, it is depending on needs. And then you start breaking down the different procedures. That would take us a full hour talk. All right. Because I cover the gamut. But everything that I do falls into three categories: bigger, longer, harder. If you want to be bigger, we're usually doing a filler procedure to make you be bigger. If you want to be longer, we got several ways to help increase the length of your penis. All right. including sleeves versus ligament release and things of that sort. If you want to be harder, then what we do is we help you out with your erections. But I got to figure out what's going on with you. All right. So if you're calling me and you just want to improve your erections, that's a paid appointment for $200 just for me to sit down and go through everything, because that's like a full doctor's appointment. I got to go through all your medications, make sure I understand what's going on, and then it breaks down. Do you have a blood flow problem? Do you have a nerve problem? Do you have a desire problem? And then we got to attack those areas to figure out what we got to do to get you back in the game. So everybody's different. So, I know I kind of generalized, answered that question, but otherwise, if I go in depth, we'll be here for another hour. And I'm going to be wrapping this up soon. All right.
After the procedure, how long is the penis wrapped in gauze?
Now, the question becomes, how long do you have to do the wrap? During that first 40 days, you're our responsibility. Yes, you're going to be wrapping. You're going to be sending us pictures every 3 days. You're going to be sticking to our rigid protocol of how we want you to take care of it. So we will be giving you a personal phone call if you don't send us pictures. And if you're not doing things correctly, you get our cell phone number so you can call us. So yeah, we're serious about what we do. And those first 40 days, you got to be focused on what just taking care of. Why? Because our results are permanent. We ain't playing. This is for real. If you want to go get some fly by night, whatever, Joe Blow, then go right ahead. But if you're talking about doing this and being bigger for life, then UroHard for Men is for you.
Have you ever fixed a venous leak?
They're different. Have I ever fixed a venous leak? Now, there are different ways to approach it. You got to understand, is the venous leak because you're not blood trapping? And what I mean by that is that when you start talking about the anatomy of the penis, the blood flow comes in through the middle of the cylinder, but it goes out around the sides. And the thing is the penis has a sheath that goes around it called the tunica albuginea. So when it goes back out, that's through the venous system. So if I don't get it tight enough where it's trapping the blood, then it just leaks out. So you get erection, but it starts going back down. Yeah, that's still leaking. All right. Or do you actually have a shunt where blood flow from the arterial side is going directly into the venous sides of the penis and you're losing blood flow that way? That is a surgical fix.
How far apart is the procedure for 2 fillers and a ligament release?
Usually what we want you...
Question. Say it again. They can't hear.
How far apart is the procedure for
2 fillers
and a ligament release?
How far do you have to wait from this one?
Well, the thing is that what I want you to do is after your first filler procedure, what we really want you to do is wait 90 days. Now, after 6 weeks, you're already back to having sex. But, we're going to do some other things because we know that you're coming back for a second procedure. So I want to give 90 days to let everything mature before you have the second procedure as far as a filler. All right. Now, once you've had that second procedure, I'll let you heal up. You got to give me close to another 90 days, and then we could do a sleeve or whatever to increase your size. But the thing is that remember, anybody can do the procedure, but you got to understand healing. That's where everything separates out from being able to do a procedure of being able to do it successfully and making sure that you have great outcomes.
Anybody asked a question on live and then we missed it didn't get answered, please DM us.
Okay. All right. So we're getting ready to wrap it up. Have we been here for about an hour? Yeah. All right. So we're getting ready to end our show. I appreciate you guys asking questions. We're here on Thursdays. Please tune back in with us. We're trying to destigmatize male enhancement. You're welcome to ask me questions. And if you didn't get your questions answered, then you can DM us or you can just call 478-225-9324. And you can also get on our website, which is UroHard.com. That's UroHard. And you can just hit the little green button down below and it'll talk to you and answer general questions. And you could tell it that you want an appointment and it'll let us know that you want an appointment, so you can still set up that way also. So we make this so easy to actually get in contact with us. You can talk to the website. You can talk to us. You can DM us. So hey, and let me just throw this last question out there. Would you rather A, be the biggest she's ever had, or B, be the one she never forgets? Put your comments in there. A versus B. I'll repeat it. A, would you rather be the biggest she's ever had, or B, be the one she will never forget? A or B? Let me make it simple for you. Usually, the biggest that she's ever had is the one she never forgets. Horns up. Wrap this thing out. Dr. Fussell's out.
Can we say one thing?
You always coming back after the conversation's over. We're done. Huh?
Don't report us for being inappropriate or
Say what now?
suggestive, because TikTok blocks us. I mean, we don't say anything vulgar, so just keep scrolling. Don't report us.
Yeah. This is an educational conversation. It's not for everybody. We do go live, and the thing is that if this is not for you, just scroll on. You don't have to watch us. But this is adult conversation, and we are actually making a difference for guys. We're destigmatizing male enhancement. Thank you for watching. We really appreciate your time, and we'll see you back on next Thursday. Horns up.